COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honorable Andrew Furey, Premier of Newfoundland and Labrador, the Honorable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Leslie? Yes? Just wondering, I just wanted you to be aware of, there was a full repeat, like a delay, 3 or 4 second repeat of everything you just said then, so I don't know if that's going to carry over to the live briefing, but that could be an issue for anyone recording, such as ourselves. I just wanted to let you know that, so there was an echo, a full repeat about 3 or 4 seconds after.
No, thanks. I heard it as well. Just a reminder for everyone to make sure you're muted. Hopefully that'll help.
Yep. Yeah, I was, but I'm not sure about everyone else, but I just wanted to
Yes.
I didn't know if everyone heard, so okay.
No, thank you.
No problem.
Good afternoon, everyone. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Monday, January 11th, 2021. Today is another exciting day on the COVID-19 front for our province.
Good
The first COVID-19 vaccinations are being administered in Labrador. Minister Lisa Dempster joined Dr. Piggott and nurses from Labrador Grenfell Health as they visited Black Tickle and Norman Bay today to give the first Moderna vaccines. Elder Wiley Ford was the first resident of the Natsivut communities in Makovic, to receive the vaccine, and more will continue. We're so lucky to be here in this moment when you think back on how things were and how they've been, how uncertain everything was, and how stressful. I recognize some people may be nervous and feeling stressed about receiving the COVID-19 vaccine, worried about some side effects, particularly hearing about some associated with the second dose, and that's totally understandable. But as a physician, joined here by two other physicians, I have to assure you, these vaccines are safe. They went through rigorous testing, and Health Canada wouldn't approve them if they weren't okay. My wife...
Premier, can I interrupt? I'm so sorry, but someone isn't muted, so we're hearing your comments feeding back.
It's distracting, for sure.
They went through rigorous testing.
Can people just ensure they're muted on their phone so that we're not hearing the broadcast fed back into the line?
It's still happening, I think.
So that we're not hearing the broadcast fed back into the line. It was still happening, and unfortunately it's going to make it challenging for those trying to use this for broadcast. So just need everyone to double check their mute.
I'll try again. My wife, Dr. Allison Fury, has had both of her doses of the Pfizer vaccine because she's a frontline healthcare professional, and she's doing just fine. We have made it this far out from the holiday gathering season with very few COVID cases. Over the weekend, the one new case was travel-related, and we're down to single digits for active cases. This is all thanks to your hard work and respect for the medical advice from Dr. Fitzgerald, Minister Haggie, and everyone at Public Health. As we look across the country, we must be very thankful to be in the situation we're in and have the sense of normal life and activity in Newfoundland and Labrador that we so enjoy. But we have to keep it up. We have to continue to follow COVID-19 guidelines, wear a mask, keep your distance, and wash your hands. This is no time to become complacent. Thank you, and I'll now invite Dr. Fitzgerald to share an update.
We have to keep it up.
Sorry, just before Dr. Fitzgerald
It's still
gets
happening,
going
yeah.
there, we are still having the feedback. So if everyone could just double check, I realize most people are thinking they're muted, but if you could just double check your line, that'd be appreciated.
Leslie, can you go through one by one?
Sorry, just before Dr. Fitzgerald
Still
gets
happening,
going there, we are still having feedback. So if everyone could just double check.
Really back to the back.
It's really hard to talk when you're hearing it. Should we restart?
Okay. Thank you, Premier. Thanks, everyone, for your patience there and for joining us today. So I'll begin with an update. Since the media advisory yesterday, we have no new cases. There's one person in hospital, and the total number of cases in our province is 393. 381 people have now recovered, with 5 active cases. And in total, we have tested 74,814 people.
In hospital, and the total number of cases in our province is 381 people have now.
Today marks 11 days past New Year's Eve, and I'm encouraged by the continued low case counts of COVID-19 in our province. I'm so thankful to everyone who has followed our guidance and sacrificed social gatherings and time with loved ones to make this outcome possible. It must be said that our own achievement is bittersweet as the situation in some areas outside of our province worsens. Jurisdictions with once plentiful healthcare resources now find themselves nearing or exceeding capacity. Protecting both lives and critical healthcare resources is the goal, and so for this reason, we cannot let our guard down. We must stay the course. I know that many of you are anxious to know when you may receive the COVID-19 vaccine, and we are currently working through administering the vaccine to the priority groups for Phase 1 and looking at further defining our priority groups for Phase 2. As the vaccine is not yet in abundant supply, we need to focus on those most at risk from COVID-19, at risk for severe disease, or those who may transmit the virus to those most at risk. We know that age is the greatest risk factor, and that will be our priority for distribution as we move into Phase 2. And while we continue to monitor evidence, vaccination rates, and epidemiology closely, anyone who receives the vaccine will need to continue to abide by all public health measures. This includes the requirement to wear a mask in public spaces and self-isolate when returning from travel outside the province. The public health measures we have in place are working. COVID-19 can only enter the province through travel, and our provincial layers of protection remain in place. Travel into the province remains limited to essential reasons only. Travellers must adhere to self-isolation requirements upon entering the province, and public health has the capacity to conduct rapid testing, investigation, and contact tracing to identify and contain cases of COVID-19. COVID is a stealthy virus, and we do not know where it will raise its head next. We must all act as though it is in our communities, because that could very well be the case. We rely on you to apply your layers of protection. So wear your non-medical mask in public spaces, wash your hands regularly and wash them well, or use hand sanitizer. Maintain at least 6 feet distance from those who are not your close contacts, even when wearing a mask, and keep your close, consistent contacts to 20 or less. If you or a family member have a fever or new cough, or if you have 2 or more other symptoms of COVID-19, even if mild, please call 811 to arrange for testing and stay home. It is critical that we know every case of COVID to ensure that it's contained quickly. Do not make the mistake of thinking that you could not have come into contact with the virus. We have had people taken completely by surprise after testing positive. If you do receive a negative COVID test, you should still stay home until 24 hours after your symptoms resolve to ensure that you do not pass on an illness to others. And do not forget the final layer: be kind to others. We all need kindness and compassion to get through this pandemic. A kind word is never wasted, and it is never the wrong choice. I think that there may be a little bit of complacency setting in regarding one of our layers, that is masks. I believe it is important to reiterate the proper mask requirements. Non-medical masks do not replace physical distancing or hand washing, and when worn properly, they add a layer of protection when physical distancing is not possible, or if you unexpectedly are unable to physically distance. What we recommend is a cloth mask made of at least 2 layers, but 3 is better. It should cover the nose, mouth, and chin, and if your mask is under your nose, it is not effective. We do not recommend plastic masks or a mask with an air valve. The openings in these masks can let particles through. It should be large enough to feel comfortable and small enough to ensure that there are no gaps. If you find a mask too restrictive, try using one of a different size or material. Face shields are not an alternative to masks, as they are open and let droplets escape. They are an option for those with a medical exemption from wearing masks to reduce risk, but they are not as effective as a mask at reducing droplet spread. Face shields should not be worn instead of masks when in public places and would not meet the mandatory mask requirements. I do ask, however, that people not confront or demean anyone who is not adhering to the mask requirements. There are individuals who are exempt from the requirement due to physical or other challenges, and remember that you do not know another person's circumstances. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in the province is 393. We are so very fortunate, but we must not take our situation for granted or become complacent. Our fortune could change in the blink of an eye, as we have seen happen to other provinces and territories. So stay strong, be kind, and hold fast. Thank you.
Thank you, Dr. Fitzgerald. I'll now invite Minister Haggie to say a few words.
Thank you very much, Premier. And indeed, it's been a good weekend. No cases, 5 active cases at the end of the weekend. And it's a weekend where we've seen more recoveries than we have new active cases. And it's also a weekend where we've seen vaccines going into more arms. Each of those separately are positive, but together they start to tell a story, I think. People are really interested in vaccine rollout. I have some numbers. As I said, the hub will be updated on a weekly basis, and we hope to have that live on Wednesday, so that information will be out there for everybody. But as of this morning, Eastern Health had 3,900 vaccine doses delivered. It has administered 2,795. That's 71% of vaccines administered. Of those individuals, 853 have had their second doses, and the balance of doses left in Eastern Health represents the second doses for those who have not yet had them. Their next delivery is anticipated this evening. For comparison, Central Health received its vaccine late last week, and in the space of 3 days has administered 60% of the doses that they have. Western Health has started administering vaccine. I don't have any comparable figures for there. And as the Premier referenced today is a landmark in Labrador with residents in Makovic, Black Tickle, and Norman Bay all receiving their vaccines. I had an email just from the Medical Officer of Health in Labrador who says that all but one eligible adult in Black Tickle has received their vaccine. He didn't give me a percentage, but he wrote that he felt that this was the highest in the world for any community, and was really, even through the email, obviously ecstatic with it. We have freezers arriving in Labrador City and in St. Anthony within the next 24 hours. So once those are commissioned and up and running, the next vaccine deliveries will be available to be sent to those areas. We have started with essential healthcare workers, primarily those on COVID units, and as opportunity arose, we've given it to others in vulnerable groups too. As we move out from our essential healthcare workers in phase 1, we will be going to the vulnerable elderly in long-term care and personal care homes. Once phase 1 starts to ramp up completely, we will then start to look at people on the basis of their risk factors in the broader community. And so we're looking at things like age, the presence of chronic diseases, and those vaccinators that have not already been covered under the essential worker public health designation. As I say, the website will be updated on a regular basis, and as time goes by, we hope to improve the presentation of the information that we put on there. Once we get to phase 3 and the general public, if such exists, we will use the mechanisms that we put in place for the flu vaccine in terms of self-scheduling and these kind of things. That will be made plain well in advance, and I would again refer you to the COVID-19 website, which has all this up there for you to read in some detail. The phase 2 and 3, we also look to have additional vaccines from maybe AstraZeneca and Janssen and things like that. So the short message for today is keep it up. You've done a great job over the holidays in following Dr. Fitzgerald's guidance. And as we roll into the new year, I'm cautiously optimistic that our numbers will not reflect any problems with those holiday periods. So I think with that, Premier, I'll wrap it up and hand it back to yourself and the media.
Well, thanks very much, Minister. We'll now open it up for questions from the media.
Thank you, Premier. Sorry for the audio issues at the beginning. Hopefully that's been resolved. But a reminder to those on the conference call line to keep your phones muted until it's your turn to speak. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Minister, you gave a few numbers from different regions. I'm wondering if you could give me the overall number in terms of how many doses of vaccine total have been delivered and how many of those doses have been administered.
You're on mute, Minister.
Minister, you're on mute.
Thank you very much, Premier.
You took the instructions very literally.
Yeah, I don't have the denominator for the other regional health authorities for sure, Peter. I do know that Central have given just over 580 doses and Western just over 300. We'll get those for you later on today.
Okay, thanks. And how do you respond to concerns that we saw today from the opposition saying that this province has one of the worst track records when it comes to vaccinations and it's putting vulnerable people at risk and delaying an economic recovery?
It's plain politics with health, first of all, and that's inaccurate. And we have one of the best public health teams in the world, arguably, given our results to date, and we continue to put our trust in them. This isn't always about speed. Given the epidemiology, it's about getting it right to protect the most vulnerable. We have our trust and we should have trust in our public health officials. And frankly, the vaccines, the way that we've rolled them out, some of it has been skewed slightly statistically and just on the law of just by doing straight up averages, which is not reflective of where we are in the vaccination process, such as the 2,400 Moderna vaccines, which we've been rolling out to the vulnerable communities and Indigenous communities today. That took some time to get to those communities, but it's also reflective of the fact that it's their responsibility to fully distribute this, and we're there to support them. And today was the first day that they felt they were able to, given language translation issues and other cultural issues that we fully respect, that they would be able to roll out the vaccine. So the numbers are a little skewed. They're also skewed by the fact that we've held some doses for the second dose of the vaccine, which other jurisdictions haven't. So if we're going to compare apples to apples, we need to really compare apples to apples, but I don't think it's fair to really compare us, for example, to PEI that doesn't have this significant challenges of geography that we do, and I think we've done an excellent job, and I have full faith in the public health officials that they will continue to do an excellent job in distributing this vaccine.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Just following on Peter's question there, why are we holding those doses back when we know the vaccine schedule coming from Pfizer and Moderna, knowing that these vaccines are coming? Why not try to push these as quickly as possible and get them in people's arms?
So we certainly are sticking to as close as possible to the two-dose schedule that was set out. We have to consider that our epidemiology does allow us to be able to do that. Other places are in a very different place than we are right now with regard to epidemiology. We want to make sure that we have enough here to be able to give that second dose on time or as close to on time as possible. There can be, these schedules can have bumps in the road, and we want to make sure that we're not left not being able to give that second dose when we should because of an unforeseen circumstance or weather or whatever the case may be. So we're certainly monitoring things, we're looking at things, but we want to stick as close as we can to that two-dose schedule.
Thank you. And in terms of the hospitalization, that's been reported for several weeks now. I'm wondering, is that the same person? And has this person, I guess, technically recovered from COVID, but is still being denominated underneath COVID because that was the reason they were admitted to hospital?
Yeah, so I can't really speak to that because of privacy issues, Kellyanne. Sorry.
Thank you.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Good afternoon. I'm looking at the recent releases on international travel. This latest case on the weekend was international travel. I noticed in the past we have given the origin of the travel from which the person came. Is there a reason that, have we stepped away from doing that now, or will you continue to say where these people are coming from, whether it be the United States, the UK, etc.?
So, it doesn't really impact the public health advice that we have to give, and it doesn't really play a role as to, how we handle the case or from a public safety point of view to release that information. So, we're trying to respect privacy as much as we can, and that's why we've not been releasing that information.
Thank you. And going back to Kellyanne had mentioned the opposition and some of their criticism. Has there been any kind of delay in, or are we getting the vaccine as quickly as you'd like, the shipments, the deliveries? And is it possible that we're victims of our own success in a way here? I mean, our numbers are so low that it does seem that the urgency is to get the vaccine to places who are experiencing high numbers infections. And so, on that note, are we victims of our own success in some ways?
No, I mean, we're not. We are successful because of the public health guidance of Dr. Fitzgerald and her team. We're still getting our fair share of this vaccine as afforded by the federal government on a per capita basis. So no, we're not victims of our own success. We should celebrate our successes in this and continue to follow the public health guidance and advice, because it's the reason we are where we are. We are afforded a different scenario than some of our cousins and family members across the country, and we need to respect that, but also realize that it was science, not politics, that got us here in the first place. We need to continue to follow the science, continue to follow public health experts, including Dr. Fitzgerald, her and her team have got us to where we are today, and we'll continue to follow her at her lead and based on science and evidence and not on political agendas, in order to ensure the public health and safety of Newfoundlanders and Labradorians.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. I want to follow up on the statistics you gave, Minister, on the number of doses that have arrived in Eastern Health. 3,900 doses would be 2 shipments, I believe, of the Pfizer. Are we not getting any more, because we assumed that those were coming before Christmas, and we haven't received any since?
Peter, our schedule is that we will get another set of doses for Eastern Health today. Is our expectation. We will get 1,950 doses today, and thereafter on weekly intervals, we'll get another 975 through February. That should ramp up to 1,950 a week for Eastern Health by the end of February. In addition, we have vaccine now going out to Central Health, so they're getting 975 a week, and Western are getting the same, and LG will also roll into that starting, I think, today, in actual fact, for the Pfizer vaccine.
Okay, thank you. The Premier said last week that the province is getting more vaccine than expected. Sometime before that, we were told that we're actually getting less. So where do we stand now on our expected doses?
Well, we're still getting more than we expected initially, as we suggested last week. The numbers initially looked like in the ballpark of 13,000 by the end of January. I stand to be slightly corrected, but now they look like they'll be more towards the 15 or above ballpark, which is not uncommon. Okay. These are estimates, of course, as we're being we're being provided by the federal government, and estimates, are just that. There's no exact number, but we are hoping to have upwards of 17,000 by the end of January, which is above our initial target.
Okay, thank you.
Our next questions are from Josie Bass of Radio Canada. Please go ahead.
Hello, everyone. Just a question concerning in terms of the numbers you just gave us. Are you planning on reaching the goals that you set before?
Yes, we are. In fact, we're ahead of our goals because we weren't expecting to have vaccine distributed until the first week of January. So not only are we hitting our targets, we're ahead of targets with that, in that regard.
Thank you. This is for me.
Thanks, Josie. Peter Cowan with CBC. Please go ahead.
Thank you. Dr. Fitzgerald, you mentioned that face shields are not an acceptable alternative. Yet I know a lot of people, for example, in restaurants, servers, for example, have been wearing those quite regularly. Why do you think so many people are wearing them, and can you explain a little bit more why they don't give the same level of protection as a regular face mask?
So if you have a face shield on, of course, it's open at the bottom, so droplets can fall out the bottom, as opposed to if you wear a mask where it's tight across the top of your nose and underneath your chin if it's fitted properly. So it certainly contains the droplets much better. I think some people feel that the shield offers them the same level of protection, and perhaps there's some misunderstanding about that, but it does not, from a droplet spread point of view, does not offer you for the same protection from you sharing your droplets with someone else. As well, we know that a mask now, we know even with non-medical masks, that there is some element of protection for the wearer, which we didn't, that information wasn't, we didn't have that knowledge initially. And when we made these recommendations, we talked about it as protecting others. But we do know that there is some level of protection now with wearing these masks. So from a protecting others point of view, certainly the mask is superior, and definitely for protecting yourself as well. So the best option, if it's something that you, isn't a medical contraindication, is to wear a well-fitted mask.
Thanks. And I just want to follow up on some of the comments about how the epidemiology here is different, and that's why vaccinations have been a little more of a slow and steady approach. Since we're in a much better spot here, why aren't we giving some of our doses to places like Ontario, where they're seeing dozens and dozens of people die every day, and unfortunately we're not?
So I think it's important for all jurisdictions to get vaccinated. Ontario is getting their share of vaccinations, and certainly, that is a consideration, and those are conversations that definitely went around the table. But I think, at this point, we recognize that it is important for all areas to proceed with vaccination.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. We've seen the most recent numbers for exemption requests and approvals, and while the numbers for both over the holidays aren't particularly substantial, we're seeing more expats indicating they're moving back to the province permanently or relocating temporarily to ride out the pandemic with their families, especially now that remote work is more common. Is the province prepared to welcome more relocations and possibly even promote it as a way to support our economic challenges and migration concerns?
Sorry, Kelly, could you just repeat? You kind of broke up there at the end.
Oh, sorry. Just with the success the province has had, and also with remote work, is the province prepared to welcome more relocations and possibly even promote it as a way to support our economic challenges and out-migration concerns?
It's in the face of the kind of acuity that we're seeing right now, it's certainly not something that we are considering at this second. However, it is something that we have considered moving forward in terms of, I think there will be a significant, be able to work from home. You can work from Newfoundland and Labrador if you're working from home. All the expats out there can have learned that they can work effectively, efficiently from their downtown apartment in Toronto. Well, there's no better place to do that instead of Toronto than on the streets here in Newfoundland and Labrador. So I think there will be a reverse urbanization effect to COVID-19, and certainly Newfoundland and Labrador will be positioned to capitalize on that.
Thank you. And I'm also wondering, now that Moderna and Pfizer will be in play in Labrador-Grenfell region, for example, are we looking at the possibility of having to mix and match some of these vaccines? Are we going to try to stay as true as possible to first dose Pfizer, second dose Pfizer, and same for Moderna?
Yes, that's correct. We will be trying to, as much as possible, stick with the same vaccine. However, if that, if we get into a situation where that's not going to be a possibility, we will stick with the same type of vaccine. So if they had an mRNA vaccine at the beginning, we try to stick with an mRNA vaccine for number 2. But our goal at this point is to complete the series with the same vaccine that they started it.
Thank you.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Hi. The World Health Organization last week issued a new recommendation just mentioning that instead of 21 to 28 days between the 2 doses, that they've issued kind of an exceptional circumstance situation whereby it could be up to 6 weeks now between the 2 doses. Are we looking at that? Is that something that could help our rollout here?
So certainly that was instituted for, in the setting of limited vaccine supply and increasing case numbers and, COVID burden to certain areas. So what the World Health Organization said is that, as much as possible to stick to the manufacturer's recommendations, but in the event that that was not a possibility or where there were other considerations such as epidemiology, that up to 42 days could be considered as an acceptable dose interval. And so that is a consideration for anybody, I guess, who is in a situation. Excuse me.
Thanks. And, sorry.
No, I was going to say a situation where there's increasing COVID burden.
Right. And just curious as to the situation. Obviously, Ontario, Quebec, are having a difficult time with infections. The numbers are quite high, and the lockdowns are in place there. I'm just wondering, on the logistical side of things, Premier, has Newfoundland and Labrador supply chain in any way been affected by the restrictions placed on those large 2 provinces that we do receive goods from?
Of course, something that we're kind of looking at and monitoring, but not to my knowledge to date. No.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. Another vaccine question. I think we learned last week that you are now able to transport the Pfizer vaccine. Are there any restrictions on that? How far can it be transported? Do the places need ultra deep freezers? How does that work?
No, so we can move it from a depot where it gets received to one other place, and it will be in liquid form. So there's no restriction on distance at this point, but they are advising that that it's just distributed out to one other place once it's taken from that freezer.
Okay. And I'm wondering, are we clear yet what vaccines are actually gone to Central and Western? Are they Pfizer vaccines or Moderna?
No, that's Pfizer at this point.
Okay. So they have freezers up and running?
Yes.
Yeah. Okay. Thank you.
Our next questions are from Josie Bass with Radio Canada. Please go ahead.
No more questions for me, thanks. That's it.
Thanks, Josie. I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
The doses of vaccine that we're receiving today, are we able to, in Eastern Health at least, are we able to start doing long-term care residents, or who will these vaccines be for?
As Dr. Fitzgerald suggested in her opening statement, age is a priority, so they are starting vaccinations in long-term care facilities today.
Thank you.
Kellyanne Roberts with NTV, do you have a final question?
Just a clarification. I just missed it with all of the feedback that was happening in the opening there. But how many active cases in the province now?
At the moment, 5.
Thank you.
Brian Callahan with VOCM, do you have a final question?
Just with regard to Dr. Fitzgerald's comments off the top again regarding mask complacency. I'm wondering if that's something you've seen personally, Dr. Fitzgerald, or if that's anecdotal or remarks that you're receiving from professionals, healthcare professionals, schools, in the public. Just wondering where that comment comes from.
Yes, all of the above. Yeah, so we've been getting some feedback with that. On that particular topic, beginning that for a little while now. So we just wanted to reiterate, the importance of it and what was considered to be acceptable in line with the special measures order.
Thank you very much.
Peter Jackson with the Telegram. Do you have a final question?
I do. The 20-person cap on informal gathering that was implemented just before Christmas, is that going to be the case for foreseeable future, or are you planning to relax that restriction at some point?
So I think for right now, we're going to leave things as they are. We're certainly going to see what wait for about 3 weeks after the Christmas season, just to make sure that there's not cases that, are popping up because people haven't gotten tested with mild symptoms but have waited until they get sicker to come to our attention. So that can take about 3 weeks or so. So we'll certainly wait that out a little bit. But, we know that now as the weather is getting colder, that gatherings tend to happen inside more than outside. So we do feel that there is, it's more important than ever to make sure you limit your gathering sizes. These informal gatherings need to be limited. As we've seen in other jurisdictions, they are, they can certainly drive outbreaks.
Thank you.
Josie Bass with Radio Canada. Do you have a final question?
No, thanks.
Thank you. Thank you, everyone. Premier, do you have any final comments today?
Sure. I'll just reiterate, because I know there's some feedback, if there's big feedback here in the room as during my opening comments, but it's a big day for the big land, and this is a positive day for Newfoundland and Labrador in particular. The first COVID-19 vaccinations are being administered in Labrador today. Minister Lisa Dempster joined Dr. Pigott and nurses from Labrador Grenfell Health as they visited Black Tickle and Norman Bay today to give Moderna vaccines. Elder Willie Ford was the first resident of Nunatsiavut to get the vaccine this morning in Makkovik. It's a big day for the big land. Again, everyone look after yourselves, take care of each other, and we'll get through this together.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.